For one thing, I appreciate the staff that they have assembled. Everyone's very friendly, everyone's very professional. At no time have I ever gone in and felt as if I wasn't an important part of their operation. Started a new job and was very tentative about, did I want to stay in Champaign? What do I do? What am I going to do? Am I selling my house? And when I go see Becky, I just kind of poured this out to her. And I'm sure she's thinking, you know, all I do is dermatology. But she listened. It made me feel better. Plus, while she's working on me, we were able to handle a couple problems, you know. So it's been very warm. It's a warm setting. I don't mind going to do it. Now I think I'm in the touch-up stage where I go back every so often and get sort of retouched. So very careful to ask me about, there's certain medications that I'm taking that's part of the hair growth is polycystic ovary syndrome. So she was the one that clued me into asking more probing questions to my physician. My confidence has increased. Self-esteem, self-confidence has increased dramatically from the point when I truly looked in the mirror and was able to look in the mirror and like what I saw when I looked back. There were times when I really could get dressed in the morning without looking in a single mirror in the house. It's amazing how much your life is affected by your confidence level and your self-esteem. Being outgoing, going into places and not thinking that they're staring at me because they see an unusual amount of hair on a female. I think that taking those steps with Becky helped to allow me to go into the gym, start working out. I worked out with a trainer for a long time. I'm starting that back up again, but that was a big help. It doesn't seem like much when you talk about it to someone that doesn't really know, but that little piece of your life was given back to you by having a face that you're not ashamed to walk around with. I decided to stay in Champaign and take a job that is actually very rewarding. And it gives me an opportunity to feel as though I'm giving back to a community that has been very good to me so far. And this is the first time I've actually been socially close to the community I lived in to work, invested in it. I belong to different organizations, and the work I do requires that I'm in the public eye quite a bit. So that's helped as well. If I couldn't go on television, I couldn't even sit here in this interview if I was the way I was when I got here 5 years ago. I would recommend that anyone seek help for things that are bothering you, period. Specifically for any sort of dermatological needs or, in my case, facial hair. Now I'm comfortable talking to somebody about my challenges with it. Before, you couldn't pay me to talk about my facial hair that you can see and I know is there. But now I talk about it to other women who ask me, who knew me. I tell them straight out. I went to Dr. Fahrner and Becky Monson. And I tell them about it. They ask about costs. I tell them it's an investment. I had tried electrolysis, which is costly and frankly ineffective, I think, my opinion. I had done previous laser, but as Becky has explained to me, early laser was not very effective for dark skin. And so it was very painful because of the charge you had to use. And really I explained that it feels like a little, to me it feels like a little tap or pinprick maybe. I'm very willing to talk to people about it because I know you're suffering inside for something about how you look or how you feel, and you can take the steps to correct it. And the doctor's office is very willing to help you do that.